Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello and welcome to the Prime Health Podcast. My name is Dr. Derek Barron, and we interview doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach healthcare and longevity. We explore breakthrough science, personal stories, and practical insights shaping the future of wellness. This episode is brought to you by Grow Solutions, where we partner with healthcare professionals to scale operations and grow revenue with AI-driven solutions. So if you want to learn more about how to take your healthcare business to the next level, just drop some of the comments in below. Now, today, let's get to the star of the show. And I'm excited to introduce you to Blake Youmans. He is the CEO at Dynamic Stem Cell Therapy, who brings a unique perspective to regenerative medicine shaped by over 2 decades in healthcare. Blake has been a nationally registered paramedic since 2003, where his frontline experience responding to medical emergencies opened his eyes to the power of preventative care. What makes Blake's story really compelling is how his paramedic work, witnessing patients in crisis from conditions that could have been prevented, inspired his transition into regenerative medicine. So for nearly 10 years, Blake has been the CEO at Dynamic Stem Cell Therapy, combining his emergency medical experience with biological sciences background to offer his patients a comprehensive view of healthcare, from crisis intervention to cutting-edge prevention. So Blake, I want to welcome you to the Prime Health Podcast.
Thanks for having me.
Yeah, you bet, my friend. My pleasure. So as we kind of talked about before we started here, you are in Henderson, you're in Las Vegas, and the weather's a little warm today for you.
Yeah, it's just getting warmer and warmer.
Okay.
Atypical for June, July, August.
All right. Well, just make sure we pay the electrical bill so that the AC stays on where we're at.
You have to.
Yeah. All right, my friend. So we'll dive in a little bit into kind of the background and your expertise and what you're doing. So what drew you to regenerative medicine, and how did you maybe transition to that field? We heard a little bit about your bio there as being a paramedic, but what drew you into this?
So really, honestly, this business started with my mother. My mother was an ER physician. She went to Temple Medical School. She did a residency when I was still very young, but she started doing a residency when I was like 13 years old. So I kind of saw the whole gamut, and I wanted to go into medicine as well, follow in her footsteps. And, like I said, she was doing regenerative medicine. She was doing medicine where it was reactive. And for so long, she was like, there's got to be a better way. So she got into prevention and wellness back in 2005. She opened up a wellness center and a med spa as well back then. And she was one of the first people doing bioidentical hormone replacement therapy. Basically, she was looking for natural solutions to help people heal themselves. And so she always believed in stem cells. She just didn't think technology was there yet until 2014 when we started with it. Honestly, a little apprehensive when we got into it. Will it work? No, it's not FDA approved. Let's try it on some patients that we worked with in our concierge business. And she was one of the first concierge doctors here in Las Vegas as well. And, we tried it. It worked. Proof is in the pudding. And we've just been helping people ever since. Unfortunately, she did get colon cancer. She ended up passing away in 2016. But on her deathbed, she was like, I think this is the best way to help the most amount of people. I think this is why God put me on this earth. I think you should continue the business. So I've continued it for my personal family. I have a daughter and a fiance. And basically, I'm trying to find better roads to help patients heal themselves. And literally that's all we're doing. We're just giving you healthy cells be it from your own body, from allogenic sources, cells not from you, to help your body heal itself. And that's literally all it is. And, I built my business off of reputation marketing. So proof is in the reviews. Our patients are getting better. They're telling their friends and family. That's what's kept me going for the past 11 years now.
That's awesome. Well, I'm truly sorry about your mother. I'm a man of faith. I believe she's looking down and taking care of you every step of the way. So I'm glad that you're able to carry that on with her. So how is the practice broken down amongst other providers in it? Do you have medical doctors, injectors? Like how does the layout of your practice look?
Yeah, so since my mother passed away, obviously I need a medical director. So I do have a medical director as a colleague of hers. His name's Dr. Dale Carson. He's a really interesting case. He was FBI. He retired at FBI at 45, and then he went to medical school. Not many people do that. He still practices medicine. He's 83, and he's still in the ER, which is crazy. Wow. But he was chief of staff over a level 1 trauma center for almost 30 years. He was the medical director for Clark County Fire Department here in Las Vegas. They replaced him just recently. 3 years ago, he stopped. Just recently, they replaced him with 2 medical directors because that's how much work he was doing. He was the medical director for Las Vegas Metro and SWAT, and he's also the medical director for Las Vegas Motor Speedway. So like be it EDC or NASCAR, he's there and available. Okay. So he's my medical director. Then I have a physician's assistant. I did have an NP, but we don't really use her too much. So she just has her own practice. And then I have nurses that work for me as well.
Okay, fantastic. So a simple question that's both from the healthcare providers and a patient that may be watching this. How do you explain regenerative medicine to patients who've never really heard of it? Or they've kind of heard a little bit, but they're, man, what is this?
Yeah. So, I mean, I would explain regenerative medicine as, what we're doing is we're giving you the basic building blocks of your human body. Obviously, when we're embryos, we're all stem cells. They differentiate to eyes, hairs, nails, teeth, heart, lungs, everything. And then what we're doing is we're using these pluripotent stem cells from umbilical cord sources to provide it intra-articularly into joints to help repair, regenerate cartilage, tendons, ligaments, muscle, sometimes even bone. And then it can promote the formation and growth of new blood vessels. They can help with nerve repair, because that's a slow, steady process. It can help you heal more than 50% faster.
Okay. You mentioned it a little bit earlier, Blake, but there's 2 terms like the sources where people will get their stem cells from. There's allogenic and autogenous. Do you mind explaining that a little bit for us?
Yeah. So autologous or autogenous is basically from your own body. Our bone marrow is producing stem cells all the time. Just as we age, it starts slowing down, doesn't give you as much. That's why, I always equate it to, there's a tree outside my window here. If I jumped out of that tree when I was 8, 9, maybe even 18, I'd probably be fine. If I jumped out of it now at 46, I'd probably be in a full body cast, and that's basically how that works. So these are multipotent stem cells that are trapped in fat. We basically do a syringe aspirate mini liposuction. We separate stem cells from fat. We neutralize and wash them. We activate them. We give them back to you same day, same procedure. And it helps your body heal itself as your body has healed itself all its life. The bone marrow stem cells, you drill a hole in the iliac crest, you suck out the marrow, process it, give it back to the patient as well. When we do allogenic stem cells, we're getting it from an FDA registered lab. What the FDA registered lab does is they pre-screen mothers age 18 to 35. They make sure that they're healthy individuals, free from diseases, funguses, bacteria, viruses. They do a full genetic profile as well, making sure you're not going to get any weird DNA because you are getting transference of DNA. Then they basically, after everything's screened, processed, and they basically what happens is a nurse from the lab goes in the delivery room. David schedules cesarean section. As soon as that baby's born, they cut the cord. Healthy baby goes with healthy mother. All that afterbirth material is taken sterilely down to the lab. Main thing that they do in the lab is they take out all the red blood cells, so there's no fear of rejection. And then once passes everything in the lab, again, they do all the screenings, testings, making sure nothing's growing in the lab. As long as that's safe, sterile, clean, they'll freeze it. They'll send it to us on dry ice. We'll keep it here in liquid nitrogen until you, the patient, are ready for it. All we have to do is thaw it and we can give it.
Okay. We talked about we both are fast talkers, and you are a fast talker. So that's
sorry, I said this so many times, but they're pluripotent stem cells from allogeneic sources. So they have more ability to become more things. They can become liver cells, like hepatic cells, and they can also become nerve cells. Whereas our own multipotent stem cells, it can become many things, but not all of those things.
Got it. Okay. So Blake, what would you think is the biggest misconception when it comes to regenerative medicine?
I would say the biggest misconception is what podcasters and other people are telling people, like, you can't get these kind of treatments here in America. They can do more outside the country, which is true. We have to use less and minimally manipulated product here in America, but we do have the FDA, which does screen and make sure that everything's safe and sterile, clean, getting to the patients. Whereas outside the country, you don't really have those safeguards in place. Some countries you do, other countries you have less of that. And if they're growing and expanding these cells in a little petri dish, if they're not doing it under completely sterile conditions and really making sure guiding those cell lineages are doing the right things without mutations or senescent cells, then that's great. But if they're not, then there's some added harm that could potentially come to a patient.
Okay, understood. Thank you for that. I appreciate it. So from a treatment approach in your practice, what conditions do you at Dynamic Stem Cell Therapy do you guys most commonly treat in your office?
Mostly knees, shoulders, backs, elbows, ankles, mostly sports injuries, be it acute or chronic conditions. So it's, older patients or more seasoned athletes or new athletes that are kind of just trying to break into, have a scout check them out, get on a professional team. We get a lot of those kind of patients as well.
Okay. What in your office, what do you determine? Is there a difference between a good candidate and a poor candidate? What would maybe exclude someone from care, or are there exclusions?
Yeah, I exclude patients all the time, unfortunately, but some people are just too far gone. I always tell people they kind of find me at the end of the internet. They're they've tried all these other treatments or supplements or what have you, and nothing's really worked. And now they're like, well, okay, well, there's stem cell therapy. Let me look into that. But sometimes, they have anatomical or mechanical deformities that stem cells are not going to be able to fix. Be it a really bad hip that's bone on bone, be it a knee that's like completely, macerated tendons and ligaments, and just like grade 4 chondromalacia where they have like no cartilage, they're completely bone on bone. Those kind of patients, they need surgery. So we're very ethical here. We're just going to tell you, yes, we can help you, or no, we cannot. And if it's a no, we cannot, we even guide you to like, here's some local surgeons that we trust, that we know, that my doctor knows from being 30 years in the ER. He'll be like, hey, this person does a really good job. I've seen outcomes for their patients. Maybe suggest go to there. So we do that a lot.
So Blake, in your office, what role does a patient's overall healthcare play into their ability to really get the benefit from stem cell therapy?
It plays a huge amount. Basically what we want is the best microenvironment for these stem cells to grow, proliferate, and do what they need to do in the body. So there's some dietary restrictions that we put people on. Obviously, we want, because these cells, mesenchymal stem cells especially, they're attracted to inflammation and injury. We don't want anti-inflammatories on board prior to, at least 2 weeks prior to. That includes steroids as well. And then afterwards, stay 12 weeks, stay away from anti-inflammatories. And then prior to, we do want someone on an anti-inflammatory or diet where they're basically on a no sugar, no gluten diet. So that's going to be prior to and post as well. Again, just basically making a better microenvironment for those stem cells to grow, proliferate, and not be detracted from the root cause of the inflammation injury that they're focused on getting to.
Okay, love it. So you take a functional medicine approach to all your patients, it sounds like, as well.
100%. Yep. So they're alcohol-free, they're sugar-free, they're gluten-free. We avoid CBD, anything that's going to be anti-inflammatory. So it's a little bit of lifestyle change for some patients. Some patients, it's, just kind of fits right into how they're already operating.
Okay, fantastic. So let's look at it as if I'm a patient walking into your office and I've got a rotator cuff issue, and we're not going to grade how bad it is. Let's just say I'm a candidate for care. Can you take me through so a patient has an idea kind of what that process would be for them?
Sure. So if you're a good candidate for treatment, we've looked over your MRI. We say, hey, we think we could get some good efficacy with you. You would come in, you would fill out paperwork, you make the payment, nurse would take you to the back. It might be just a straight injection, or sorry, a straight blood draw, or it might be an infusion with IV. It really kind of depends on the full gamut here. But, we're going to take some blood from you. We might just give you stem cells, exosomes. We might be doing a full liposuction procedure where it's a syringe aspirated mini liposuction. So there's very little downtime, but we do give you twilight sedation, fill you full of fluid so you don't feel anything. We take the fat that's necessary. We separate stem cells from fat, neutralize and wash them, activate them, give them right back to you, same day, same procedure. In a direct injection, maybe give you an IV infusion as well. We can do that. Or if it's the umbilical cord stem cells, and we just take them out of liquid nitrogen, let them warm up a little bit. Patient warms them up in their hand. We add it to platelet-rich plasma or exosomes, and then we'll do a direct injection under ultrasound needle guidance.
So it sounds like you've done this more than once.
A lot.
That's good. So patients should feel very comfortable coming into your practice. I can only imagine.
100%. Mm-hmm.
Let's look at the industry itself right now from a science and innovation aspect. What do you feel is the most exciting breakthrough you've seen maybe in the regenerative side most recent?
There's so much with medicine and what they're doing. Like in Japan, they're probably doing the most when it comes to stem cells. I just heard recently where they're actually like drilling a hole in a spot where someone has a TBI or traumatic brain injury, or they're having like a seizure disorder, or they had a stroke, and they're like, okay, it's right there. So they'll drill a hole and they'll just directly inject stem cells. There was a paralyzed man that got 2 million stem cells. He's able to walk again now. They're bioprinting hearts and spraying stem cells on them, and our bodies are accepting them. I mean, it's kind of incredible. And with AI influence as well, I think it's just going to be even more medical breakthroughs that are going to come to the forefront.
Okay. That's incredible. It'll probably take a while for the U.S. to grant those the ability to do that for patients.
Yeah,
baby steps for us here. How do you stay current with what's happening out there in that side of the world?
Yeah, I mean, I just kind of read a lot, and I know what's out there to make sure that, we want to stay on the forefront and be the ones that can provide these kind of treatments. But there are some limitations, We're not brain surgeons. We're not going to go in and drill a hole in your skull and inject. Like, there's a lot of issues with that, obviously. So maybe at Stanford and, those kind of medical institutions, university institutions, they'll have some grants or something available, and the expertise to really give those treatments in the safest and best ways possible. I know in Japan, they're doing it in those kind of institutions. And, if patients want to get those kind of treatments, they're like hundreds of thousands of dollars. So I'm doing a lot less, but still getting really good results. And we're doing it in very safe ways. When we give stem cells for spines, we do it paraspinally. We don't go interdiscal. We don't go into the facets. If we're going to do like a stroke treatment, for instance, we might give an intranasal administration to try to get to the cribriform plate, which most direct route of administration. But we're not going to be doing anything that's potentially harmful in any way.
Okay. All right. I'm sure everybody is appreciative of that as well.
Yeah.
So from your practice perspective and some growth aspects, unfortunately we all have challenges in business. What is your biggest challenge in your practice when it comes to regenerative medicine?
I guess it would just be education, and, there's big podcasters talking about other countries. So, trying to get the medical tourism back into the United States and maybe into a city like Las Vegas where people already want to visit anyway, instead of just the fun aspect of Las Vegas. You can get the top rated medical treatments with these vetted labs here in America. You don't have to go to Tijuana, which is not a very nice place if you've ever been there. Panama, like, you can go to a nice center, but you walk around the block and it's automatically not nice. So, and there's also, like, if you get these kind of treatments outside the country, there's no legal recourse if something goes wrong. And that's another thing. Bring it back to America, make it safe, have people recover in their homes. We don't need to do all the fluff, keep you there a week, do red light therapy, hyperbaric, whatever. You can go to those centers around your house and just go back home and know that you're safe.
Yeah, that's a great point. It's much easier to heal in a comfortable setting than an uncomfortable setting, for sure. Yeah.
It could be a 5-star hotel, but you're only there for a week. You still have more healing to go to.
Yeah. So what do you do from a practice perspective to educate the patients in your community?
I do my best face-to-face, obviously, but, social media, I've been doing a lot of reels and FAQ, informational pieces, YouTube, Instagram, what have you, all those other social media sources to kind of try to get it out to the masses. This is what's available. This is how we do it. This is how it's better or different than other companies out there. So as much as I can, get it out to the general public or face-to-face.
Okay, good. All right. What advice would you give another physician in a practice that's maybe considering implementing regenerative medicine into their practice?
I think it's great. I think you should do it. It's definitely helping patients. You can tell by our reviews. These are all real reviews. We have real followers. We don't pay for anything. Our patients are getting better. Regenerative medicine is the answer. Our bodies can heal themselves as they always have. We're just facilitating your body to heal itself by giving you these cells. As long as you're getting it from the right lab, you're not cutting costs, then I think you're going to see amazing outcomes for your patients. So it's something that you should definitely incorporate.
Perfect. Thanks, Blake, for sharing that. So from your perspective, when you started there almost 10 years ago, how's the demand changed for regenerative procedures in practice from the general public?
I would say a lot more. Joe Rogan is one of those podcasters that talks a lot about it. He's like number 1, number 2 podcast in the world. So he gets a lot of followers. A lot of people are interested in what he has to say. And he does talk a lot about stem cell therapy, which is great. Tony Robbins has a big following. He wrote a book called Life Force. The whole first chapter is about his experience with his shoulder and getting stem cells. And, not only did his shoulder get better, but his back got better too by getting his shoulder injected. So, it has great systemic benefits as well. Wherever there's inflammation, injury, these cells, they're programmed by God to get to the root cause and start fixing what needs to be fixed. So it's amazing.
Awesome. From a business perspective, if I were able to hand you a magic wand and you could wave it over the practice, what is one thing from the business perspective you wish that you could fix? I don't mean it has to be broken. Maybe it's whether it's patient retention or patient education. What's one thing that if somebody could snap their fingers and the genie comes out and Robin Williams starts talking to you,
I think a subscription model is great. I would love to do something like that. The only problem is when we fix people, they're fixed and then we don't see them again. So,
all right. Fair enough.
Yeah.
All right, we'll ask some questions maybe about what patients would want to know from a success standpoint. What metrics do you use in your practice to measure success beyond just a patient outcome of saying, I feel great?
Yeah.
What do you use to show that impact?
Yep. So we do evidence-based medicine here. So what we do is quantitative. Obviously, qualitative is great. I want you to feel better. I want you to have better quality of life. But quantitatively, I want to be able to prove it. So we get an MRI before, then maybe 9 months later, we'll get another MRI, and it'll show proof positive that things have changed.
Okay, fantastic. So from that perspective, Blake, what would be probably one of your biggest outcomes or like they went from 100% skeptical to your biggest fan? Like what was one of those cases in your practice?
Gosh, I've had so many. When it comes to joints, we've seen up to 70% cartilage regeneration evidenced by MRI, which is huge. And there's nothing else out there that really repairs and regenerates cartilage. like stem cell therapy has the capability to do. So us having those outcomes has been incredible. So, I would say that's a big one. I've helped people with diabetes. I've helped people with rheumatoid arthritis. They had markers for these kind of things, and now it's gone. I've had people go from heart failure from 14% up to 55%. People diabetic, like I was saying, they used to take insulin all the time. Now they take it here and there. Obviously, they still measure and monitor the glucose, so they take it when they need it, but it's much less than it used to be. Or some people are in pain management and they're taking a lot of pain pills. They've gone from I had one patient who was like, I take 40 Percocet a day to 2, which is huge. And obviously that's going to benefit their liver and their kidneys and everything else by getting off of those. And, I don't know if you've ever been on those kind of narcotics, but it doesn't, you're not yourself when you're on those.
Correct.
Well. It dulls everything down. These they're just blocking pain receptors. So the pain's still there. So what the benefit of stem cell therapy is that it gets to the root cause and it mitigates that healing response from there. So it has a potential to fix at the root cause, which if it fixes the root cause, all the symptoms should go away as well. And less reliance on pain medication, obviously.
Okay, so you shared some incredible patient outcomes. What do you do? How do you explain the expectations of a patient? Somebody may want to come in and say, I want my knee pain 100% gone. Can you guarantee that? There's no guarantees in too many things, death and taxes. Maybe that's about it, maybe a couple other things, but how do you manage expectations in patients?
Yeah, actually, I have it on my paperwork. I'm like, how much are you expecting? And, it's 10 to 20%, all the way up to 100%. And the people that say 100%, I just say, okay, let's mediate your expectations. This is your MRI now. This could be the potential with stem cell therapy if you're a good candidate for treatment. And then this is where I could potentially get you. And with 30% be life-changing, based on your condition, or maybe 80%. And for some people, 80% is the bee's knees. That's all they need, right? And then they're happy. Some patients, they are professional athletes, so 80% isn't really going to do it for them. But maybe they'll get 80% this time, and then I'll do another treatment, and it'll give them the 90%, 100%, so they can give their coaches 110%, like they're asking.
Okay. This is a time to brag. And I just want to be fair. What do you feel you do better at dynamic stem cell therapy in the Las Vegas area than anyone else does in the community?
Yeah. So, I do have local competition, obviously. One just does bone marrow aspirate only. So they're doing that for orthopedic conditions. I have another competitor that just does the fat-derived stem cells. But here's the thing. We've been doing it the longest in Las Vegas. We have the best experience. I know one of the competitions, their doctor was there and then they moved. So it's a new doctor. He's a good guy. I have nothing bad to say about any of my competitors worldwide, really. But, what we do best is that we're all in one and we're a niche company. This is all we do 24/7. We're utilizing all methods of cellular medicine to give a body what it needs to help it heal itself. So, we're not giving you fluff. We're not doing red light or hyperbaric or peptides or, Myers cocktails or any of that kind of stuff. You can go somewhere else to do that. We're just giving cellular medicine to help a patient heal from their joints or XYZ medical condition. Our motto is bringing hope to patients with unmet medical needs. So that's our focus.
Love it. That's solid. I don't know why anyone would say no to that. That's for sure. So Blake, the last question I have here for you is, how can someone get a hold of you if they have questions or if they would like to set up an appointment for care?
Yeah, so it's dynamic stem cell therapy if you look it up on Google, but our website address is stemcellpowernow.com. Our phone number is 702-547-6565. And you can always reach us by email, contact@stemcellpowernow.com.
And I'll make sure, Blake, to add all of those details in below once we wrap this up for it. So is there any question you wish I would have asked that I didn't? I guess I lied. I said that was the last question.
Yeah, I mean, people always ask me, I frequently ask questions, right? People ask me, are there any side effects? How soon will I get better? Those kind of things. But side effects, there are none. I've never had any negative outcomes. The only side effects I see are positive ones. The positive ones I always see: better mental clarity, brain fog lists. Some people that had to wear reading glasses don't have to wear reading glasses anymore, more energy, sleeping better. And then gut mobility, motility helps. And then some people report better libido as well. So all positive side effects. And then how soon will I feel better is another common one. I always tell people is 2 weeks to 6 months is my easy answer. Normally the first few days, we're limiting your mobility. We don't want you doing anything that's going to cause more inflammation or injury. The first 6 to 8 weeks are super important because that's when the stem cells are working max efficacy. So that's why we put these people on dietary restrictions. That's why we limit their mobility. I don't want you pushing it at the gym or going golfing with your buddies, even though maybe it's on the plan as a tea time. Avoid those things that are going to cause more inflammation or injury so your body can heal. Obviously, rest equals recovery.
Yeah, all important. I appreciate it, Blake. So thank you so much for sharing your insights and expertise with us today. Your unique perspective is really interesting from the emergency medicine side. Regenerative therapy really helps our audience understand the full spectrum of healthcare possibilities in regenerative medicine. So for our listeners, if you found today's conversation valuable, please subscribe to the Prime Health Podcast and share it with someone who could benefit from learning about regenerative medicine. If you know anybody in the Las Vegas area, please do look up Blake and his company. You can hear from, he's got passion in what he does and he'll be able to help. We'll be back next week with another healthcare innovator who's changing lives through cutting edge treatments. But until then, stay healthy, keep exploring new possibilities for your wellness journey. Thank you very much, Blake. I appreciate it.
Thank you so much. Appreciate you.